Near to the program. He is a virologist at Lancaster University in the United Kingdom. Doctor, thank you so much for being with us. These two vaccines, which were developed separately, they both appear to have very high levels of effectiveness. What does that signal to you?
I think these are really encouraging and have really boosted our optimism on the vaccine. And first, for example, when we had the Pfizer vaccine, those were interim data, and we were not really, at that scale of optimism. But once having the Moderna almost at the same level of efficacy, I think this is really a rubber stamp that we will have a vaccine, and we will have a vaccine very soon. That means this is really a big milestone and really a watershed moment.
Can you tell us how do the Pfizer vaccine and the Moderna one differ in terms of application and storage?
So both Moderna and Pfizer vaccines, both they are based on the same technology called mRNA-based vaccines. What it does, it takes the genetic material of the virus, inject into the cell, and in the cell it produces the protein that is onto the surface of the virus. Our body immune system sense it and start producing the antibodies and also the T-cell response, and both together really protect the vaccinated people. So basically the technology is the same. However, there are some differences that make one better than other. For example, Moderna vaccine can be stored at the freezer that is minus 20 Celsius, which is very common on the pharmacy, surgery, and the small hospitals. Whereas the Pfizer vaccine that required minus 80 Celsius storage, will definitely required a separate infrastructure such as liquid nitrogen or dry ice carrier to really transport and ship. And I think one of the major advantages with the Moderna vaccine that is based on results announced today is that it not only protects just against the milder form of the infection, but it also protects against severe form of the infection. So that is really a plus again, other than the storage over the Pfizer vaccine.
Okay, that's great news, because with the Pfizer vaccine, a lot of the negative that we heard was that it needs to be kept in this super, super cold freezer to be effective. Doctor, can you shed any light for our viewers on how multiple vaccines coming out at the same time could help push up the timeline of how long it takes to get control of this virus?
Absolutely. I think this is the most critical question to understand at this moment, is that not one vaccine would be enough to really immunize the people at the level that we needed to do. First, because there are challenges in the production, and then there are challenges in the distribution, and each technology we are having in different vaccine frontrunners, they are based on different principles. So this means that we have to have 2 or 3 vaccines that have a capability to produce billions of doses before we can really start seeing the impact of this vaccine. So Pfizer and Moderna, they are based on the same technology, but AstraZeneca, Johnson Johnson, and Sputnik 5, they are based on the different technology, and all of them, they are on the same technology themselves, which means that if we have mRNA-based vaccine and adenovirus-based vaccine, that means that we will have capability enough to produce the vaccine that would be at the scale to really see the benefit in curtailing this pandemic.
We're seeing countries such as the United States and the United Kingdom enter contracts with these companies for hundreds of millions of doses of these vaccines. For countries that maybe don't have the economic power of some of in the Western world, I mean, are we looking at a situation where maybe it becomes where the coronavirus still exists in certain poorer parts of the world while it's already gone in other parts?
I think this is again a very excellent question, because I think once the vaccine would be registered through the regulatory body, the next question and the challenge would be how the equitable distribution could be made. As you said, that more of the wealthy nations, they already have flagged the vaccines and really sort of meeting the capability of these pharmaceuticals to produce that vaccine. So the pharmaceutical don't have any more capability to accommodate requests from other poor countries, for example, based on the cost or the pledging at the time. But one thing that WHO does, which I also be part of, is that to have a facility that can secure the doses of the vaccines for at least vulnerable communities in the low and middle income countries. So I think the emphasis should be from now onward is that not that the vaccine should be given to the one who have the wealth, but given to the one who need it, because until not everybody is safe, nobody is safe.
Dr. Mohammed Munir from Lancaster University, thank you. Really appreciate you helping us understand this news.
Thanks for having me.
Ethiopia's